When you buy health insurance, you pay a set amount called a premium each month for your health insurance coverage. If you get insurance through your employer, your premium is usually deducted from your paycheck each month. You become a member of a group or plan, and everyone's premium payments are pooled to cover the cost of care for anyone belonging to the plan. Spreading the costs among the group protects you if it costs more for your care than the amount you actually paid in premiums that month. That pool of premium payments covers you so you don't have to come up with the full cost of your care, which could be really expensive if you paid for it all yourself. Most plans require you to share in a portion of your medical costs through a copayment, co-insurance, or deductible. But these out-of-pocket amounts are still a lot less than paying for healthcare on your own. Sometimes you need more care than other people in your plan, sometimes less. It's a balancing act, and the idea is that the big pool of your group's premium payments is enough to cover the cost of care for everyone in your group. So you may not need a doctor today, but with health insurance, you're covered, just in case. And that's how health insurance works, plain and simple. If you want to learn more about healthcare in language you can understand, go to healthcareplainandsimple.com.
Hello, my name is Ross Manson and I'm with Eide Bailey to talk to you about healthcare reform and its implications to all businesses out there from an employer perspective, but specifically to employers that have greater than 50 full-time equivalent employees. For those organizations, they are going to have to be taking a look at a number of factors as we move into the healthcare reform environment in 2014. The first is if they offer insurance, do they offer an affordable health plan, and is it an adequate health plan? The second is if they don't offer insurance and send their employees to the public exchanges, they could potentially pay penalties associated with those full-time employees. And then the third is what new marketplace options are happening out there in the marketplace for them to take a look at employer-sponsored healthcare coverage in the future. And we're going to talk about a number of those implications today and the factors that employers need to consider. So the first question that an employer needs to address is, am I a large employer or am I a small employer? In the determination if you're a large employer or a small employer, the first key number that an employer needs to look at is 50 full-time equivalent employees. If you have greater than 50 full-time equivalent employees, you are deemed to be a large employer and subject to the rules and provisions of the Affordable Care Act and the potential penalties that exist under the Health Care Reform Bill. If you are under 50 full-time equivalent employees, you are deemed to be a small employer. You are not subject to the penalties, but you are subject to other rules and provisions of the Affordable Care Act. And the definition of 50 full-time equivalent employees is the first thing that an employer needs to look at is their full-time status of employees under the Affordable Care Act. And those individuals, there's anybody that works more than 30 hours a week or 130 hours in a month will be deemed to be full-time status under the Affordable Care Act. Secondly, the organization needs to take a look at their part-time and their seasonal employees. And those part-time and seasonal employee hours need to be added up on a monthly basis, divided by 120, and then you get to an equivalency factor that you add to your full-time equivalent employees. Once you've done that for every month within the calendar year, you will then add those numbers up for the year, divide by 12, and that will give you your status whether you're a greater than 50 or under 50. Now there is one final caveat that an employer that's close to the 50 range, if they have seasonal employees that work less than 120 days, those individuals cannot be the one that push them over the 50 threshold. So something to take a look at if you are around that range and you do have seasonal employees in your organization.